Did you know the right time to have sex after childbirth? Well, welcome to our YouTube channel. I'm Dr. Siraj, a women's health specialist. I'm here to take you through when to resume sex after childbirth. So, I think we all understand after being pregnant for 9 months, it reaches a time when you have to go into labor and then go through the experience of childbirth. And then after you successfully deliver your child through either normal delivery, assisted vaginal delivery, or a cesarean section. But then the question is, does this determine when you're supposed to resume sex, depending on the mode of delivery? Yes, it does. For example, if you went into the hospital and then you had your spontaneous vertex delivery without any tear, then we say, when will you resume sex? After 4 weeks, you're ready to resume sex with your partner. And then if you had assisted vaginal delivery, this is where we assist you to deliver, either by vacuum or forceps delivery. Now here, you may get things like episiotomy, which actually these are like cuts that are made on your perineum when you're delivering. You may experience a bit of pain, and this may actually prolong your time when to resume sex. However, it doesn't prolong for a long time. You may resume at around actually 6 weeks, or if your pain is well controlled and there is no pain, you can also resume sex at 4 weeks, just like someone who delivered normally. Then we have others who deliver by an operation, what we call the cesarean section. So when you operated to assist you to deliver the baby, you also have pain you experience, and usually this will also take around 4 to 6 weeks. So in brief, when does a woman resume sex after childbirth? You resume sex after childbirth between 4 to 6 weeks, depending on how you feel. If you no longer feel any pain and you're comfortable with your partner to resume sex, then we say a minimum of 4 weeks. However, if you're still having any disturbance, for example, pain, abnormal vaginal discharge, what we call leukia, then we say we can add on 2 weeks to make 6 weeks. So on average, resumption of coitus is between 4 to 6 weeks. Well, that's the recommended time, which we said is 4 to 6 weeks when you're supposed to resume sex. However, there are special considerations for a few women. For example, if you still have abnormal vaginal bleeding, we shall actually first treat whatever your infection that you have. Then after some time, we shall give you a clearance when to resume sex. Others, we may have actually dyspareunia or pain during sexual intercourse. Still, you'll have to come to us for examination in the hospital. Then we find out if you have things like papillary endometritis. You'll get the appropriate treatment, and when you get healed, still we shall tell you when to resume sex. But ideally, in our setting, commonly, we are able to resume sex between 4 to 6 weeks. And I want to say thank you for watching our YouTube channel. I remain Dr. Siraj, your women's specialist. Thank you very much.